Hello, and I would like to welcome you to this portion of today's Safety 101 training. In this part of our meeting today, we'll be discussing how heat can put stress on your body and how we can guard against different types of heat illnesses.
Our goal for today's presentation is to help you understand how our body handles heat, how an increased temperature can increase the potential for accidents, why your body's cooling system may fail you, different types of heat-related illnesses, what the factors of heat illnesses are, what personal factors may contribute to heat illnesses, and the basic preventative measures for heat-related illnesses. Understanding heat stress starts with understanding how your body copes with heat. Our bodies attempt to maintain a constant internal temperature of 98.6 degrees Fahrenheit on average. But sometimes, due to air temperature or physical activities we're engaged in, our internal body temperature can exceed 98.6. When this happens, the body tries to bring the temperature back down by getting rid of excess heat. This is accomplished in two ways. The first is to vary the rate and the amount of blood circulating at the skin surface. As blood circulates closer to the skin surface, excess heat is released. But sometimes this isn't enough. When it isn't, your body senses it is still overheating and signals your sweat glands to release sweat onto the skin surface. Evaporation of sweat cools the skin and eliminates excess heat from the body. When these two mechanisms work well, your core body temperature drops or stabilizes to a safe level. Even when your body's internal cooling mechanism is working correctly, the effects of coping with heat can still put you at risk of injury. With so much blood going to the surface of your skin, less and less is going to your brain. This reduces your alertness and mental capacity. You can find yourself less able to retain or recall information. More blood at the skin surface also means that your active muscles and other internal organs are getting less. This causes you to feel like you're losing your strength or growing fatigue much sooner than you normally would. In addition, sweat can also cause problems. The slipperiness from sweaty palms may cause you to drop items. Your safety glasses may end up fogging up and affect your vision. All of this can add up to safety hazards. In fact, studies have shown that more accidents tend to occur in hot environments. In addition, a higher body temperature and physical discomfort can cause us to get irritable or angry and cause us to overlook safety procedures and divert our attention from hazardous tasks. Even when your body's internal cooling mechanism is working correctly, heat can still cause problems. But sometimes, under certain conditions, your natural cooling system fails. When this happens, you could face even more serious medical problems. Some could be fatal. One problem occurs when the outside air temperature is as warm or warmer than your skin surface. In this case, blood brought to the skin surface doesn't help you cool. So there goes your body's plan A. So with plan A gone, your body falls back on plan B, cooling down by sweating. The problem here is that for sweating to effectively cool the body, moisture has to evaporate off the skin. But when we have high humidity, your sweat doesn't evaporate as fast. So there goes plan B. Now we start to have some problems. we'll consider some of the distinct medical conditions of heat-related illnesses next. Heat stroke is the most serious of the heat stress disorders. It reflects a total breakdown of your body's temperature regulating system. Pumping blood to the skin surface and sweating becomes inadequate as your body temperature rises to potentially fatal levels. What makes heat stroke especially dangerous is that it comes with little warning. However, there are some danger signs. With your body temperature reaching 103 degrees or higher, you may feel feverish, you may have stopped sweating and your skin will become hot, dry, red, or spotted. You may experience a headache, rapid pulse, chills, and have difficulty breathing. You may also find yourself becoming mentally confused or disoriented. If untreated, you may even go into convulsions or lose consciousness. Heat stroke should be treated as a serious medical emergency. Left untreated, it results in death. 4,000 Americans die every year from heat stroke. Victims of heat stroke require immediate hospitalization. If you find a coworker you believe is suffering from heat stroke, immediately notify your supervisor and have someone call 911. Until medical help arrives, administer first aid. Move the victim to a cool, shaded area. Lay him or her on the back, or if nausea exists, on the side. Loosen and remove any heavy clothing. Do not leave the victim unattended at any time. If conscious and not feeling sick, have the victim drink a small cup of water. If possible, immerse the victim in cool water or cool the skin with a wet cloth or a wet sheet, or by spraying him or her with a cool mist of water. Fan vigorously to help improve cooling through evaporation. Remember, early recognition of heat stroke is the only means to preventing death. The symptoms of heat exhaustion may resemble some of the early signs of heat stroke. Heat exhaustion is caused by a loss of large amounts of fluid through sweating, often accompanied by excessive loss of salt. Unlike heat stroke, someone suffering from heat exhaustion still is sweating heavily. Skin will be pale and cool, pulse will be rapid, the victim may experience extreme weakness or fatigue accompanied by giddiness or nausea, headache or blurred vision, and in more serious cases the victim may also vomit or faint. Treatment in most cases involve having the victim rest in a cool area with the legs elevated, loosen or remove heavy clothing. Give the victim plenty of liquids, cool the skin with a cool spray mist of water or a wet cloth, and fan him or her. With this treatment, mild cases, the heat exhaustion usually recovered on the spot. However, those more severe cases may require further care over several days. If the victim doesn't feel better in a few minutes, notify your supervisor and get emergency help. Heat cramps are painful muscle spasms that can sometimes occur after physical exertion in an extremely hot environment. Sweating causes your body to lose salt. When you replenish the fluids you sweat out by drinking water, this can dilute the remaining salt levels in your body. If the salt level in your muscles gets too low, then you begin to cramp. Onset is sudden. Painful spasms occur in your legs, arms, abdomen, and tired muscles. Your skin will also be hot and moist. Although spasms will generally occur during or shortly after exertion, cramping can continue for hours after work is completed. Treatment for heat cramps includes drinking plenty of fluids, rest and massage the cramp muscles. Drinking salted liquids, or often the sports drinks like Gatorade, help replace the salt and help you recover quicker. To prevent a repeat case, if you know you're going to be performing hard physical work in the heat, try adding a little salt to your food with your meals. Salt tablets are not recommended. Dehydration occurs when the body gives off more fluids by sweating than it has taken in. Sometimes, as in the case of muscle cramps, salt levels may also fall too low. Signs and symptoms are overall fatigue, weakness, and dry mouth. Treatment is fairly simple. Replace the lost fluids and salt. Just to expand a little on the point of salt, again, if you need to replace the salt in your body, the best way to do it is to add a little salt to your food. Salt tablets should not be used. If you're on a low sodium diet, check with your physician. Heat rash occurs in hot, humid environments where sweat isn't easily removed from the surface of the skin by evaporation, and the skin remains wet most of the time. This causes sweat ducts to become plugged and a rash to appear. Left untreated, heat rash can become infected. Symptoms are small pink pimples accompanied by intense itching and in some cases mild tingling. To treat heat rash, wash the affected area with soap and water. Then apply a soothing lotion to relieve the itchiness and discomfort. This condition can be prevented by resting in a cool place part of each day to allow the skin to dry and regularly bathing and drying the skin. Now that we've seen some of the various heat-related illnesses that can affect your health, we're going to now turn to prevention and talk about what you need to watch out for and what you can do. We'll start by looking at some of the situations and conditions under which you're more likely to be at risk for a heat-related illness: the environment you work in, the type of work you're doing, and your own physical condition. All three of these factors play a role in heat stress. Once we know what to watch out for and the times when you need to be even more aware of heat stress, we'll turn to some of the steps that you can take to reduce the likelihood that you'll become a victim. The most obvious environmental factor when it comes to heat stress is air temperature. The higher the air temperature, the faster your internal body temperature rises and the more difficult it is to cool down. Remember, if the temperature is above 98.6 degrees Fahrenheit, your body loses its ability to cool by pumping blood to your skin surface. It's not the heat, it's the humidity. Well, it's both. Higher humidity not only helps increase your internal temperature, but at very high levels, humidity can prevent your body's ability to cool itself by sweating. Heat that comes off a piece of equipment is called radiant heat. When you're working near a piece of equipment that gives off heat, this increases the amount of heat your body is attempting to offset. When air is circulating, this generally tends to help your body cool down by helping your sweat evaporate. When you're working in some place where there's little air circulation, your body will not be able to cool down itself efficiently. Next to your environment, the most important factor is workload. What kind of work are you doing? Heavy lifting, repetitive lifting, or actions likely to cause your body to use a lot of energy raises your internal body temperature. When you're doing work that requires a lot of physical exertion in the heat, you need to take special care to monitor yourself for signs and symptoms of heat stress. How long you're working also is important. Working for an extended period of time in the heat without rest reduces the amount of time your body has to recover and cool down, especially in terms of sweat evaporation. Repeated exertions have a cumulative effect. Your internal thermometer keeps rising. Clothing is also a factor. Heavy clothing impedes your body's ability to get rid of heat. If you're working outdoors, you're more likely to feel the heat if you're wearing dark colors. Dark colors absorb the heat. Light colors reflect the heat. There may be times when you need to wear some personal protective equipment to accomplish the task that you're working on. If you're wearing PPE, be careful. Know that respirators, full body suits, face shields, goggles, even gloves tend to reduce the efficiency of the body's cooling system, making it more likely that you'll be affected by heat-related illness. So anytime you're working in a hot environment and using PPE, take special care to monitor yourself for signs and symptoms. A good way to help your body recover is to take these extra layers of personal protective equipment off while you take breaks and lunch. It's difficult to predict who will be affected by heat stress and when, because individual susceptibility varies. But there are some general rules of thumb when it comes to who has an increased risk and who should be even more alert in monitoring themselves for signs of illness. Age is one factor. Put simply, the older you are, the more at risk you are for heat disorder. Workers over 40 have an increased risk. Total body water decreases with age. The aging process tends to cause a sluggish response by the sweat glands. If you're overweight, you're also at increased risk. Yet another reason to lose that spare tire. The increased layer of fat prevents your body from efficiently releasing heat, and your body surface to body weight ratio is less favorable for heat release. In addition, the extra weight means a greater expenditure of energy when working and greater portion of blood flow spent on cooling. Drugs and alcohol should not be used on the job. Maybe that's another talk for another day. But drugs and alcohol and excessive heat are a dangerous cocktail. Among other things, alcohol causes your body to dehydrate faster. Caffeine also causes your body to lose water faster. So go easy on the coffee if you're going to be working in the heat. If you're on medication and you're doing heavy physical work under hot conditions, make sure your doctor knows about it. Also, if you've had a heat-related illness in the past, be aware that you are much more likely to have another episode than someone who has not suffered from heat-related illness. Now that we have reviewed some of the factors that can increase your risk to heat disorders, we'll talk about some of the steps that can prevent heat-related illness. We've seen that many of the heat disorders are related to dehydration, so it's important to keep your water intake equal to the amount of sweat you produce. You may produce as much as 2 to 3 gallons of sweat over the course of a workday. Don't depend on thirst to signal when it's time to drink. Interestingly, most workers exposed to hot conditions actually drink lower amounts of fluids because of insufficient thirst drive. When you're working in a hot environment, drink 5 to 7 ounces of fluids every 15 to 20 minutes to replenish fluids that you've lost by sweating. When exposed to the heat, your body undergoes a series of changes that make continued exposure to heat more bearable. Under normal circumstances, this adjustment period takes about 3 to 5 days. Once you become acclimated to the heat, you'll find it possible to perform with less strain and distress. However, heat disorders are more likely to occur among workers who have been away from hot environments and have gotten accustomed to lower temperatures. If you return to work after a vacation or extended illness, your body won't be quite up to the task right out of the gate. When working outdoors, wear light-colored clothing. Remember, dark colors absorb the heat. Light colors reflect it. Always wear the lightest weight clothing possible, preferably a breathable material like cotton that allows the heat to be released. Also, change from wet clothing to dry clothing whenever you can. The use of PPE such as full-face respirators, gloves, and goggles can add to the heat load. Try to choose the lightest possible breathable PPE. However, if the trade-off is between comfort and safety, always choose safety. If possible, use work rest cycles. When working strenuously in the heat, take an occasional break in a cool area to let your body recover. Try to perform the most stressful tasks during the cooler parts of the day. Shift non-essential tasks to a time of the day when the heat is lower if you can. Eating right can also help prevent heat-related illness. Hot foods add directly to your body heat. Heavy meals redirect blood flow to your digestive tract instead of the skin surface. It's best to eat light meals during work and heavier meals when your workday is over. Sufficient sleep and good nutrition are important for maintaining a high level of heat tolerance. So when your heat is on, get plenty of rest and eat right. Now we'll briefly recap what we've learned today. We started by looking how the body copes with heat, how it gets rid of excess heat by increasing blood flow to the skin surface and sweating, and saw that coping in this manner can lead to reduced mental alertness, cause weakness, fatigue, and cause objects to become slippery, all of which increase the chance of accidents. We've learned how high air temperature, high humidity, and loss of fluids and sodium can sometimes cause the body's cooling mechanisms to break down and cause serious heat-related illnesses. We looked at how to recognize and treat the most common heat-related illnesses, such as heat stroke, which can be deadly, heat exhaustion, heat cramps, dehydration, and heat rash. We also reviewed some of the contributing factors to heat-related illnesses, which include environmental factors such as air temperature and humidity, physical work factors such as the work that you're performing and the clothing you're wearing, and personal factors such as your age and physical condition. We also learned what can be done to prevent heat-related illnesses. Drink plenty of fluids. Give your body time to adjust to the heat. Choose proper clothing and scheduling job tasks to take the heat into account.